Yes,
and you
ma'am.
have to share Shashibala ma'am's and Archana ma'am's CV. Okay.
Okay.
We are live.
Yes, ma'am. We are live now.
Good evening, dear all, and welcome to the 7th session of Tuesday Tea Time with Dr. Kawita Bapat. Why today's webinar is important? Because why we want to know why 1 lakh doctors and healthcare workers gathered on 27th March at Jaipur. Why Rajasthan doctors to hold rally in Jaipur observed as a Black Day, and why we are all from every part of India is supporting them. So we'll start our webinar today. Please join with me and welcome our two chairpersons, Dr. Sashi Bala ma'am and Dr. Archana ma'am. And I thank you, ma'am, for being here. Dr. Sashi Bala ma'am.
Complete name, Dr. Shashibala Bhosle, madam, from Gwalior.
Yes,
Dr.
Dr.
Shashibala is the
Bhosle,
president
ma'am.
of the Jaiwan Society, and she is from GRMC Gwalior, and she is doing a great job as being the president of Gwalior. Now,
Yes.
Dr. Archana. Yeah.
Can you please, I welcome Dr. Archana Basir, ma'am. She is MSDNB, FRCOG and FICOG consultant, obstetric and gynecology, and director of Akash Hospital from Indore. She was vice president Foxy at 2022. She was organizing secretary of AICOG 2021 Indore, fellow representative of AICC RCOG West Zone, Imaging Science Committee Chair SAFOG. Past position holding the chairperson of Foxy Imaging Secretary Committee from 2015 to 2017, organizing secretary ISAR on 2016, and managing committee member ISAR 2018 to 2020, IAGE 2018 to 2019, and ICOG 2017 to 2019. So welcome, ma'am. Now I hand over the session to Dr. Sashibala, ma'am, to take it forward. Welcome, ma'am.
Thank you, Richa. It's my great privilege. Yeah.
Good afternoon, Leela here.
Oh, Leela madam.
Yeah,
Yes.
Leela ma'am.
Welcome, Leela madam.
Welcome.
Good afternoon. Good afternoon, Anil Kaur here.
Yes, Anil
Yes.
madam
Good
reporting.
afternoon,
Yes.
everybody.
Welcome,
Leela
welcome.
ma'am.
Dipti is there.
Leela ma'am has joined.
Leela ji,
Ma'am,
namaste.
see her.
Good afternoon, Didi.
Just calm fast.
Yes, I would like to go forward. Welcome, everyone. Today, we are going to discuss what is the draconian law, a law never seen. So this is too much. We all must react to it. Just sitting like
Definitely.
that and hai kya, wo kya. See, people like Kawita, we need a lot. She went there right in front. This is how a leader should be. A leader should rise to the occasion. Leela Vyas ma'am is one son, and Kawita, I'm so proud of you. I'm so very proud of you. You are so futuristic. You are so dependable. And I tell you, we need more visionary people like you. And you are एक अकेला ही कविता चलाचल वाला है. मैं कविता के साथ अगर आप लगेंगे तो I think she will take you to tops. So, this law, and without wasting any time, I would like Kawita to say, because doctors की तो कोई सुनता ही नहीं है. Like we are downtrodden तो थे ही, अब तो trodden भी हो गए, अब तो बिल्कुल मटिया मेट. So this is not done. And Taru, this is not for Rajasthan alone. All the political parties are not going to support us. They will actually support them because the public counts for them, and we are a little, we do not count at all. So over to you, Kawita. Welcome.
Thank you so much, Pam. We will just do briefly as we want to teach everyone, learn simply, learn simple.
But your CV, shall I read out?
It's okay, Pam. It's okay. We won't waste time. No, CV is not important.
Over to you. Over to you.
Yeah, I'm just sharing my screen. That's more important. And that's put in the point. See, I'm really thankful that Dr. Leela Vyas, Dr. Charu has joined today with Anil. And these are the people, they have the opinions. They are such a hardworking people. They do so many things. Yesterday, I have seen the way they work, the way they act, and the way they put things. But right to health, everyone should know. That's my agenda, to make everyone learn simply what is right to health and what about the right of the doctors. See, this is the structure of the healthcare in India. India has multi-player universal healthcare model that is paid by the combination of public and private health insurances funds, along with the element of almost entirely tax-funded public hospitals. This is the one thing with the healthcare system. The public hospital system is essentially free for all Indian residents, except for the small, often symbolic co-payment in some services. Since this country's independence, the public hospital systems has been entirely funded through the general taxation. Now, why this fear is palpable when we talk about this subject is 82.7% of the doctors in India feel stressed out in their profession. This is the latest data I am talking about. 46.3% fear violence in the main cause of the stress in many doctors. 24.2% of the doctors fear being sued. 62.8% are unable to see their patients without fear of violence. So, and 57.7% have thought the hiring security in their premises. This is the data, and why we are here together is because we can show you the government of Rajasthan, the Department of the Medical Health and the Familiar, this Rajasthan Right to Health Care Act has been given in 2022 recently, and see how the doctors are being, the police in charge, Lati charge during the protest in Jaipur, and all the Monday, everything happened. Why this is being done? This is the penalties, why we are worried, why we are talking about all these things are any contravention during the negligence as denied in details in the rules of any provisions of this act or any rule in order to made issued thereunder shall be punishable with a fine not exceeding the rupees 10,000 for the first contravention and not exceeding the rupees 25,000 for the repeat contravention. So problem is very, very simple. There are two things are there just to make everything understand. Because of the Rajasthan Right to Health Act, if I'll accept the patients to see, then I am troubled. And if I'll say no to see this type of patient, then also I have been troubled, and the penalties are there. If I am doing some negligence, again the charges are there. And if I'm not seeing the patient, that is also a chargeable. And you can see how much people did yesterday. And I have been witness this thing. Lot many, almost 50,000 to 1 lakh people were gathered, and how they behave, you see, this is the protest.
भान शान या की जान गाहो दान आजे धनुष के बाण पे उतार दो ठंड बोले के तुम आज जगी घड़ी के तुम हार दो भान शान या की जान गाहो दान आजे धनुष के बाण पे उतार दो.
You can see the amount of it was a sell-up. It was a sell-up. I congratulate Dr. Tarun, Dr. Leela, the way they were behaving, the way they were calling people, and the way they were doing things. I really admire the administration. I admire the policy.
So प्राण दे जो मन करे सो प्राण ले वही तो एक सर्वशक्तिमान है की पुकार है ये भागवत का सार है कि युद्ध ही तो वीर का प्रमाण है औरों की भीड़ हो या पांडवों का भीड़ सका है वही तो महान है. किसी की हवस नहीं, किसी पे कोई वश नहीं, क्या जिंदगी है ठोकरों पे मार दो. तो अंत है नहीं तो मौत से भी क्यों डरे, ये ताके आसमान में दहाड़ दो.
Even a political party, then when they want to collect people, they pay. And these are the doctors, they were gathered by their own, without anything. Because this is a reason.
दया का भाव या कि शौर्य का चुनाव या कि भय का वो भाव तुम ये सोच लो। दया का भाव या कि शौर्य का चुनाव या कि भय का वो भाव तुम ये सोच लो। पूरे फाल पर जल है विजय का लाल लाल ये गुलाल तुम ये सोच लो। तुम केसरी हो या मृदंग केसरी हो या केसरी ये सोच लो।
You can imagine the way now what is the act of the health? This is 2022. Number one, in 1996, Supreme Court held that right to life, that is Article 21. It included the right to health within its fold and also pointed out the obligation of state government to provide health service. It is varied from state to state. It is different from state to state. Like a Madhya Pradesh has different thing and Rajasthan can have different thing. But under the constitution, public health, sanitation, including hospitals, dispensaries, come under the state list. The act was enacted by Rajasthan Legislative Assembly on March 21, 23, despite the protest by the doctors. The act grants several rights to the patients across the state of Rajasthan, but does not address the issues raised by the doctors. Now, we, the doctors, are there having two issues and few concerns. Right granted by the bill, right to avail free outdoor and indoor patient department services, medicine, diagnostics, and public health institutions. Emergency treatment, care, all public health providers without any delay waiting for the payment, prepayment, or the public police clearance. In this right, they receive the information about the nature, the cause of illness, results, complication, cost of the treatment, assess, and the related records. Informed consent before the specific test and the treatments. And the confidentiality and the privacy in the treatments at all healthcare establishments, referral transport, safe quality healthcare, and grievance readdressal. So what are the issues? Number one issue is emergency treatment without any guarantee of payment. This is the issue doctors are raising. And this is in the C. They say without prepayment of the requisite fee charge. And they should be prompt, that should be necessary, the right treatment, they should get the critical care, they should get the obstetric emergency care by the healthcare provider. And in case of medico-legal nature of the case, no healthcare provider or the healthcare establishment shall delay the treatment merely on the grounds of receiving police clearance or pluralism. So the problem arises in the two ways. Number one problem is if you report to the police and it is delayed, or you need not to report the police and you start treating the patients. So this is really a big issue because in both the conditions, the doctors are either sued or in a problem or in a trouble. There is an issue number one again. We are happy to treat the patients in the emergency situations, but the act should have ensured that the paid for the work once we have provided the treatment. This is the concern about the doctors. And the act does not define emergency. Kisko emergency mole, this is really a big thing. The government will define it later and call anything an emergency. So they have not given the right directives. This is the emergency, this is not the emergency, what is this? And basically, in this written, emergency means accidental emergency, emergency due to snake bite, animal bite, or any other emergency decided by the state health authority. So the doctors are worried, what is emergency? A mother bringing her child who is only 6 months old, crying all night is an emergency, or when she'll have a snake bite, animal bite, or any other thing. And the state will decide what is an emergency. Another issue is in medical legal cases, we can't promptly inform the police. This exposes us to the harassment, prosecution, or the police, and the act should be protected us. Then the intention of the omission of given information offense by the person bound to inform, whoever knowing, having the reason to believe that is an offense being committed, or informing respecting the offense he is legally bound to give, shall be punished, and the term which is extended for 6 months, fine, and the both. So this is a big second issue about how we'll save ourselves from the medical legal cases. Now issue number 2, provide free treatment without any compensation. There are chances in the cases, this is D, this right to avail the free health services from the clinical establishment, but the chances that they are not going to be paid by the government. So that's another point. Again, the issue number 2, the Act mandates doctors of Rajasthan to provide completely free treatment, and it does not ensure payment by the insurance or otherwise. So this is another problem. And the terms and conditions will be prescribed later, but there is no guarantee that they will ensure and they will be paid. So its terms and condition is the word with a star that they will get paid or not. It's a troublesome. So this is the right of freedom. Into 19(1)(g), that's the problematic to all of us. All citizens should have a right to practice any profession or any occupation, trade or business. Like a doctor's is similar to the other, and we have a right to freedom. We can charge, we can take professional fees, we can decide to have this patient or not to have the patient. This is our issue, and we can refuse the patient we want to take it. So our right of freedom is going because of this draconian law, and that this act violates our right of profession guaranteed by the Constitution of India by mandating is to provide our expertise without pay. It's we will decide to take the money or not to take a charges. Our Constitution requires everyone is compensated for the services they provide. We all agree, and you have seen so many videos are there. Now these are another concerns over there. This is the Neeraj Damor, President of Jaipur Association. When you already have schemes such as Chiranjeevi cover the majority of population under existing rules, why bring the RTH to impose on the doctors? He said, and there are several clauses doctors are still objecting, including the word deficiency, emergency, then compelling the doctors from one specialty to treat patients outside their specialty as a part of emergency. So there are existing scheme, and such ensures the patient in affordable care. Other concern is, another Sunil Chug is the president of IMA Rajasthan said, the responsibility and duties that a patient and a caretaker should have towards the healthcare facility, and we should have a respectful to providers, avoid crowding with the patient, not an abusive with a violent behavior, timely meet with a financial responsibility extra. The act should have included a clause which protects the interests of doctors. And this is a big thing, and that's what the reason they are asking to drop the bill. One more concern, this act is increase the hooliganism is very, very important, which will increase the rift between the patients and the doctors. And the third important point is doctor will look to evade these kind of patients rather than treating them, as obviously no hospital can pay from their own pockets. Now what to do next? The act has been passed by the assembly but not notified by the government. So what we want to do, this means that government can still non-notify the act. This is the one thing. Withdraw the act, make suitable changes to the act and protect the livelihood of the doctors. And what can we do? So like the letters from all association of the personal level, we can post it, we can do it. And like this, which all things people have done. And the important thing, it offers only not to notify bill without the bill immediately refer the bill to the committee of doctors for their comments. And fourth is the enact the legalization and the beneficial for both and the patients and the doctors. So thank you so much. I think this is the point which we want to see, but I am today here. I have invited few experts with me that they will love to talk about, so especially Dr. Leela Vyas is there, Dr. Charu is there, and Dr. Taruchaya is there, Dr. Anil is there, and anybody wants to act, just raise their hand and they can speak. Today is and Archana Baser, I think she has already joined. She will give the expert comments today.
Kawita, can I speak first?
Yes.
I'm in some family function.
Yes.
Firstly, thank you very much. Yesterday you came, and definitely that this gives that how we united in our country. We all obstetrician. The most important thing is that, as Kawita has explained everything. So hi everyone, those who are attending this, definitely from the MP society. I really, in our society, I'm very much thankful to you that you have taken this our problem. And I think this will become a nationwide problem gradually, because every government is saying, oh, it's good, I will accept this thing. So one most important thing is that the obstetric, as Kawita has explained, that emergency has not defined. And they have included obstetric emergency. So obstetrics, everything is in emergency. So this is one of the big point which we have to take under consideration. And Kavita, you told us that there are 3-4 points what to do about that. I think we have to say no to this bill. This is only just they roll out this bill from there, because you can see that if they will bring any wrong thing, even the prime minister, prime minister of this country has withdrawn that bill. They will say, ki, oh, kisano ke saath kya hua? So we have to fight for our right. We all are talking about that. Why not? We should get all. We are also the citizen of this country. And as per constitutional, they have mentioned that every professional has their right to accept what they want to do and what they don't want to do. So I think even on this bill, means we all are doing all, you have all seen these pictures that how silently this rally was. Nobody can think of that. This big crowd, more than 50,000 persons were going on the road, and there was no any mash. So all were going in a very disciplined way. If we have made up line properly, 3 or 4%, I think this line could have gone to more than 10 kilometers. At least we were that time in jumbled up way, because everyone wanted that I come and I take this photograph, and everyone so excited that they wanted to present that their hesitation should go and the government should listen to them, and the public should also listen. So that's why it was a 4 kilometers long, and everyone came by their own will. Nobody has forced them, and this is no sponsors. So everyone is giving their money and doing this thing. Double mare. You have stopped working. You have to pay your all staff and everyone. We all know that, yes, doctors can afford to not to work for a month or 2 months. That is, but you have to pay your all staff because they can't afford to without their paying them. So this is all by the will. And my request to all fraternity throughout the country and all the obstetricians, you support us. If the time comes, then everyone should shut down their practice. They close their these institutes and come in front and work and say to the government that we are doing. If I think the doctor community is that, sub jaga 1%, 2%, they are doing some wrong thing. But in doctors, it's very less person. आप मान के चलिए कि if someone is doing today wrong, but they have done so many good things in their life. So I never blame any doctor that they are doing wrong. They are always thinking about their patients. I always explain our patient, if they are coming and saying, कि madam उसने गलत किया, मैंने कहा no, they can't do anything wrong. Because if they will do wrong, they themselves putting they in a problem. So nobody in this world, they will put themselves into a problem. So whether they are doing for you or whether they are doing for themselves, they will do always right. So doctors are never wrong. This message we have to convey in society, because the government is कहते हैं ना वो तो बहरी है, वो नहीं सुनेगी. At least public should come with us.
I interrupt Leela. At the end of the discussion, what we want, not to notify that act, which is in still
Yes.
in that. They should withdraw the act, and they done what thing. They should make a very suitable changes and protect the livelihood of the doctors. Am I right? This is the basic
actually this time we are on the part that they should withdraw this law. This bill should be withdrawn.
You don't want any changes.
No changes.
Yeah,
Changes में तो फिर वही है. देखो changes में क्या होगा? हमारे को छोटा मोटा lollipop हाथ में पकड़ा दे.
Thank you so much. Today our expert is
Thank you very much.
Thank you so much for being with us. Thank you so much. And just give a minute. Dr. Archana Baser is there. She'd just like to put few words, and so that we can conclude this program. I am sure so many people are there. They will love to speak, but this is a half an hour program, and we want to make it smart, fast, so that the take-home messages should be clear and crisp. So over to you, Dr. Archana, and I think a word from Anil and word from Taruchaya, I will like afterwards.
Shall I speak?
Hi, Kawita. How are you?
I'm good. Dr. Baser, I'm good. Yeah. Dr. Baser, over to you.
Yeah, I must congratulate you for taking up this subject. Can you hear me?
Yes.
I think it's very pertinent that you are talking about this. I think we all have to say no to RTH, because it's very, very important then why doctors or communities only to be targeted, right? Everyone has right to good food, right to good clothes, right to good schooling. Are we telling that schools take our children for free education or give everything for free and the government will pay later?
गाड़ी
So
बंद कर
I
देना
think that's not
और
the
वो
right
बाद में कहे जब
approach,
सामान
and you
लाते हैं।
have really pointed everything so very well in your talk. I think when Dr. Leela was also talking, that we all stand united and say no to RTH. So,
Thank you so much.
so very well taken up
Can I-
topic, Dr. Kawita.
Thank you so much, Archana. I think a line
want
from
to-
Anil, Dr. Anil, a line from Taruchaya, and a line from Dr.
Yeah,
Baste, and our
I'd just
Dr.
just
Jyoti
like-
Banglowala is also contesting for the
Yeah.
post of
Yeah.
committee chair. Then she'll also put a line, just a line fast. Yes.
Yeah, I'll
Only
just
3
make a
minutes.
point. I'll just make a point over here. In Telangana, this rule was passed only in case of emergency. If an emergency is brought to your doorstep, you will not refuse the emergency for lack of money from the patient. You will stabilize the patient and ship the patient to a government hospital. And it has worked very well. The doctors cooperated, the hospitals cooperated, the nursing homes cooperated. After all, doctors are there for service. That is their basic human nature. And they cooperated very well. There was no hooliganism on that count because they were given immediate first aid. It was mentioned, give first aid, stabilize the patient and ship the patient to the hospital. It's not that obstetric case aaya to tum uska delivery karke hi usko bhejoge. That part of the bill is really wrong. They should remove this bill completely. It is not worded properly and it is very lopsided. Yesterday, I heard the speech of one of the ministers in the Rajasthan Assembly. It was laughable. You know, that mindset, I don't blame the politicians for that. All doctors are very rich. So what? We work so hard for it. That is what we should convey to the public also. We worked hard for it. Today, IT graduates study till the age of 24 and earn lakhs of rupees by the time they're 40. Almost everybody is a crorepati. See how we work. That message has to go out to the public and it will only come with unity. But unfortunately, in my long tenure, I have seen that these kind of agitations fizzle out because doctors don't cooperate with doctors. That is the unfortunate part.
So
I
many
think
part.
that
But yesterday the Rajasthan doctors have shown the integrity, unity, and solidarity yesterday, and really we are proud of them to do.
Yeah, and I think they should spread it till the bill is withdrawn. Every state should take it up in a big manner. एक दिन के लिए ओपी बंद करो, क्या हुआ? एक दिन के लिए पूरा कंट्री में ओपी बंद कर दो. बंद. After all,
At least
Can I say a few words?
Yeah, Dr. Taru, then Dr. Baste, then Dr. Jyoti Banglowala, and I think last Dr. Palm, Shashi Bala Bhosle.
Only 1 minute only.
Yeah, 1 minute, yes.
As in Telangana, you say that the emergencies were taken care of and as a first aid only. But now there is, under this law, we have a compulsion of doing all emergencies and we have to shift by our own conveyance also.
Yeah. And who will define what emergency? A mother with a child?
No definition.
The
All
definition of
obstetrics,
emergency is really complicated.
all obstetric care is emergency. We try to say something amendments in the law, but still they are not willing to do what we want to do. That is why there is much of agitation in this.
Over
The
to
protest should
Dr.
continue till it is withdrawn. Protest should
Dr.
continue.
Baste. Over to Dr. Baste, then Dr.
Yeah, I congratulate
Banglowala,
Dr.
and then
Kawita.
to Palm. Yeah.
Congratulate Dr. Kawita Bapat. You are the first one to take out the presentation also to make it a point to.
Dr. Baste, I have not done anything. It's a just additional thing. I have not done anything. So don't.
At least you have
Thank
put
you so
up the efforts to put it in front of the Foxians. And I congratulate Taruchaya, Leela Vyas, Preeti, the way they have protested and made it a point that Foxy should be represented during the rally, because this is unjust for the doctors, and I feel we are feeling very insecure, and this will spread throughout the country. So we have to deal with it with showing our integrity, and the law should be reverted back with our request, or at least it should be diluted. Thank you so much.
Over to Jyoti Bangalore, and I think then I'll request Dr. Shashi Bala Bhosle
Thank
to
you,
conclude this.
madam, for giving me the chance. Just I want to put one word. There is everybody have the right to choose their livelihood in the ethical and legal ways. And being a doctor, we have also a right to choose our profession, our patient, and our fees. And if without giving the fair compensation for our services, this actually this bill should be withdrawn, because 19(1)(g) is saying we have the right to earn by our degree, by our profession. And if you are not giving compensation, and compensation, if as Taru said, if we give amendments, and if we spend 1 lakh rupee for emergency service and they will compensate us by the 10,000, then also we will in the loss. And humanitarian ground is different, as Anil madam said. Sometimes mob comes and they shift the patient, then what with that particular doctor will do? So there are so many government hospitals, there are so many charitable hospitals, there are so many Ayushman, Chiranjeevi, Anmol, many Yojana the government is doing. So there should be ample amount of ambulances and services to shift the patient. Not always the doctor have to put the
Thank
on
you.
the board.
Thank you so much, Jyoti. And I am really thankful today, the videos which are open today, especially my own friend Rita Mishra is there. My Dipti
Madam, Dr. Vidyadhar Ranade, Dr. Vidyadhar Ranade, he is so agitated, and he actually just joined to give support to all of us. Because since day
and
one,
Dr. Lalita Shukla, I am finding as a video open over there. And now over to Palm, just conclude it, so that I have taken almost 1 minute extra. So Palm, you can conclude it. And even the Chitra Mandal, I am fighting. The videos which are open, I can say the names of them only.
Actually, this right to health, their idea was a very noble one, that everybody should get access to the healthcare. But the thing is, to put it on all the onus on the doctors is not fair. So, like, there are government hospitals, as Jyoti said, there are so many yojanas going on, but all people, they want to be everything at their doorstep. They just want to be like, we are taking villages, Godh le lo, like that. They want the doctors should take care of each and every human being. So that is humanly not possible, because education is so expensive nowadays, and we all have slogged, and we have our children to look for. So how can they expect? So Kawita, you have taken up a very good point, and we must not budge from our stand. We must make it a point to change the law. No more dilution like here and there. So that won't do. And I'm really very, very, I don't know, but I think nothing is going to come out of it if we are not so united. We'll have to take a drastic something.
We have to unite India-wise, because this law has to come all over India very soon.
Yeah, very soon.
Let me say one word of appreciation, Dr. Kawita Didi, that you have really opened my eyes, that still now this has not become law. Means like still it can be withdrawn.
It is into this, but yet to governor has to sign.
Yeah, there is only two
So
ways.
just like
not to question why you are but to do and die. This is just like that.
That is true. That we are living with the sword since the Consumer Act started, because it was not earlier.
That was the first.
That was the first sword.
Yeah, even the Chitra is raising the fingers. I think I'm going beyond time, but it's all
okay. Thank you.
Beyond. The Chitra wants to say something, and even Nirja Puranik is there.
Thank you, Kawita Di.
Thank you. Ritu is also there.
Okay, bye.
Chitra, say Chitra.
Yeah, I'm from Rajasthan. Thank you, Kawita Di, for taking this initiation. और मैं जो सबसे बड़ी बात कहना चाहती हूँ, जब ये बिल के लिए डॉक्टर्स से मीटिंग हुई थी और जो पॉइंट डिस्कस हुए थे वो फिर बाद में विधानसभा में नहीं माने गए, इसीलिए डॉक्टर्स बिल्कुल तैयार रहे हैं कि हम इस आरटीएच बिल में कोई भी संशोधन चाहते हैं. इसीलिए नो टू आरटीएच एंड ओनली
No means no.
No. Yeah. Thank you so much, everyone.
Okay, thumbs up.
Thank you so much, everyone. There is a small video we can have about this act, and everybody can read it.
I just want to ask one thing.
Yeah,
are the government doctors are also with the private doctors, and they are on strike in Rajasthan?
Yeah.
From tomorrow.
Yeah.
And that's why there is no effect. Now, last 10 days and public is not in problem, so that's why they are not listing you.
Yesterday, I think yesterday it happened.
Since last 4 days,
Whole-
2 hours, 10
whole
hours strike,
community
9
should
to
go on
11,
strike.
every government hospital.
Yeah, that should also shut down, and emergency should also shut down. If we are dealing with the emergency, then there will be no effect. Emergencies and JD junior doctors, they should also come in this strike.
And junior doctors are with us for last 4 days.
Yes,
Resident doctors involved since last 4 days, and
Yeah.
tomorrow is the complete strike, except
Then
emergency.
definitely they have to go down. If the government doctors are also with them, then definitely they have to go down. Otherwise, there will be no effect.
I think we need
गवर्नमेंट डॉक्टर्स
nationwide
इस फेवर में
shutdown.
नहीं है, जब गवर्नमेंट डॉक्टर्स इस बिल को मानने को तैयार नहीं है तो प्राइवेट कहाँ से तैयार होंगे? यही तो सबसे बड़ा इसकी आयरनी ऑफ द बिल है.
So there are many Vibhishan and many Gaddars. So what can you do? But you have to.
I think I will conclude. We will have this meeting without on the live stream or the recording someday. So all of us can put our own words.
Thanks. Thank you,
Otherwise,
Kavita,
sometimes-
for taking the initiative.
and otherwise the
Triggered our
sometimes
emotions. Now you, we
Yeah.
all are.
Vibhishan was with Miss. Vibhishan
Dr.
was
Vansha.
with Shri Ram.
Dr. Vansha,
So
where are
all
you?
the Vibhishans will be
I
with
know.
us.
Okay,
I'm here, I'm
Neeta,
here.
Neeta, you are
शारदा
right.
जैन की भाषा में जयचंद है सब.
Thank you so much, everyone. I am so happy that everyone joined
Thank
today
you,
and
Devi.
that we could discuss it.
Thank you, everybody.
Thanks to the democracy that we are able to speak.